For more on this, Dr. Mohamed Faisal Hassan joins us now from Manchester in the UK. He's the spokesperson for the Sudan Doctors Network, which is an organisation that facilitates communication between doctors from all across Sudan. Really good to have you with us, Doctor. Your organisation has been sounding the alarm over the last 2 years of this brutal civil war. Tell us what your organisation has been doing on the ground there to help the countless number of Sudanese who are trapped in this conflict.
Yeah, thank you for having me, actually. So Sudan Doctors Network is an organization. It's just a purely volunteering organization made by a lot of doctors and people who are involved into the medical field as doctors, pharmacists and dentists and paramedics as well. So basically, our main thing is just because since this war started, we noticed a lot of violations against the hospitals, the medical facilities, the centers, as well as the medical personnel who are working in these hospitals. They've been a target by the rapid support forces for a reason or another. We lost a lot of doctors during this war. We lost more than 238 doctors up till now. We have few doctors are kidnapped, few of them are hostage, and most of them actually we don't know what's happening to them at the moment, and also we have a large number of missing doctors. So in view of that, since these medical people who are working in a difficult situations, they've been targeted by the rapid support forces, we felt like we need to shed the light on these people as well as the atrocities that happens in these hospitals, because patients and doctors as well, they are equally targeted by these forces during this war since the start. We noted a lot of violations happen to the doctors, to the patients, and actually there are so many also human right violations as well happened when the war was in the central states of the country, like Khartoum, Al Jazeera, and Sinai. And now we actually, as everyone knows that we are witnessing a horrible violations happens in the western part of the country. Specifically, I'm talking about North Darfur state in Al-Fashir and in North Kordofan as well. And now we see pretty much awful violations happens in South Kordofan state as well. So so this is in a nutshell about the Sudan Doctors Network. So it's a full voluntary organization from different people who are working in the medical field, mostly are doctors, and we have other non-doctors colleagues. So we do have members throughout the hospitals in the country that keep feeding us with the reports and up-to-dates about the humanitarian and the health situation in their hospitals, in their areas and their catchment areas. And that's why Sudan Doctors Network, all their reports are very accurate because we don't rely on anything. We rely on our teams, and we have a very strict verification process of all the press release that we release in our social media platforms before. We need to double check on each report that we get from the ground before we release it to the media.
Your organisation, as well as others, has been calling for an immediate end to hostilities, but there are reports that a Trump advisor had said that neither of the warring parties have accepted the US president's peace proposal for Sudan. How concerned are you that this conflict will continue with no end in sight?
Yeah, I mean, to be honest, our main concern is we always keep telling people that, like, patients, hospital, doctors, all these medical facilities, they shouldn't be like part of the equation of this war at all, you know. So we see no reason, and we find it very difficult to convince ourselves, like when we see this artillery shelling and targeting to the hospitals and to the hostages and to the patients, and this mass killing that we've seen in the Saudi hospital by the rapid support forces, we see no reason. These hospitals, these staff and these patients, they're not part of this war. They shouldn't be part of it, and it's absolutely not acceptable at all, you know, when we see these things happening. Initially, when we kind of following the timeline of these violations, we thought maybe this is a side effect or this is a collateral damage of these things. But now what we've seen in the fashion, clearly this is a systematic targeting to the health system in the city. Clearly they want to do, during the siege, the RSF was targeting these hospitals multiple times. We've seen doctors have been targeted as well. We lost a lot of colleagues in North Kordofan. As I mentioned at the beginning of my report, we lost so far almost 238 doctors, and this is a large number, and it's very unforgivable at all. And also we see violations in a form of kidnapping doctors and medical staff from the hospital and demanding ransom from the families of these doctors, as we've seen what happened by the RSF when they invaded Al-Fashir city. These are completely unacceptable violations. I think the international world community shouldn't accept that. I mean, has gone far and beyond. This has to come to an end. At least if the warring parties, they're not at this stage, they're not in a position to go for any ceasefire or any agreement. But I believe RSF specifically, these are the most documented atrocities that we've seen. They should commit to the international law in terms of not targeting the doctors and the hospitals and the patients and people who are even working in the humanitarian field, as well as even the media personnel, as we've seen a lot of journalists and a lot of correspondents to the international media networks that have been actually kidnapped and targeted as well.
Okay, Dr. Mohamed Faisal Hassan, we'll have to leave it there, but we wish you the very best of luck with your work, and thank you so much for joining us.